Dr. Rose Joudi there. Thanks, Kate. So we're very honored to have Dr. Rose Joudi from Carya come to speak to us about older adult mistreatment through an ethnocultural lens. So I will stop sharing and hand it over to you, Rose.
Fantastic. Good morning, everybody. Thank you so much for inviting me. It's so lovely to be here. So lovely to see some familiar names in the chat as they're entering the room. So thank you so much for the opportunity to listen, I guess, to a conversation that has been of quite of interest, I guess, in the past year or so, at least from my end. And so what I will do is I will start sharing my PowerPoint. And I do apologize, and I was mentioning this to Kate and Helen as I was entering the room, that I do have another speaking engagement soon after. So if I do sound a bit rushed, I do apologize ahead of time.
You can see the individuals. Oh, there we go.
There you
Super.
go. Yeah, I know it takes a while to
Yeah.
register. So thank you so much for doing that. And yes, if anyone's sharing any insights or gems in the chat, please let me know, because sometimes I don't see that. So as Helena and I and Kate actually from last year were chatting about me coming in to present, we came across each other, I guess, through other work that I've been doing, but really focusing on ethnically diverse older adults when it came to the topic of elder abuse. So it was a really great opportunity for me to also look at how I can apply some of that information that I acquired through that project that I did for a year at Carya, when it comes to working with, for yourselves, healthcare professionals who are working with ethnically diverse people. I really want to start by acknowledging the diverse backgrounds of everyone who's attending, and also your diverse experiences and your personal journeys, as well as your role in healthcare. It's so important for me to say this, because I really acknowledge all the hard work that you're all doing. I do believe, however, that we are lifelong learners, and that we continue to need to acquire knowledge and information and insights that help us actually be better at what we're doing. So it's very important to also highlight that because of the increase in the diverse populations in Canada, but also in the province of Alberta, Alberta is now the third province. Behind us is Ontario and BC, who historically have had a number of immigrants entering those provinces. Alberta is now number 3 in terms of the number of ethnically diverse individuals residing in the province. We have internal immigration happening from Ontario and BC into the province, as well as having external immigration from outside. So the reality is we will inevitably have to deal with people who are culturally and linguistically, spiritually, and culturally diverse. So this whole topic around working with older adults is really enhanced because we find from research that individuals who are ethnically diverse, so culturally, linguistically, spiritually diverse from the mainstream population, and for us here in Canada, it's still considered a Western white population who are mainstream. When individuals who are aging or growing older experience forms of mistreatment, exploitation, or abuse, when they're from an ethnically or racially diverse background, they are actually less likely to talk about it to formal agencies or to reach out and seek support and assistance. And so it's really important for us to have conversations about how we can intervene or prevent the experiences of older adult mistreatment. It is complex. Most of the times it is hidden, especially if culture, family, and community play a dynamic role. And this actually is quite prominent when we're talking about ethnically and linguistically diverse populations. So what I would like to share with you are the objectives and, of course, the agenda at the same time. The hope is in the short time that we have together, I will share with you information about why culture is important when it comes to the perception of older adult mistreatment or elder abuse, to recognize the signs, to think about that cultural sensitive lens, and maybe to talk about strategies that might be helpful. So we'll talk about that in terms of what it is, the signs, the responses, and some of the key takeaway notes as well. As I'm exploring this topic, I would really appreciate if you think about or even share in the chat with us your own backgrounds when it comes to traditions, cultural, familial, environmental traditions that are related to older adulthood or adult care. The reason why I say that is when you look at linguistically, culturally, spiritually diverse populations, as they are integrating or entering and settling in new countries, they still tend to bring in with them their own values, their own traditions and beliefs and the way of life. It is so important for us to be mindful that when we're working with people who are diverse, that we have that acknowledgement in mind. And I always say this when I work with professionals. It is important for you to acknowledge your own biases and stereotypes. The reality is we all carry them. Acknowledge them, respect them, honor them, and then put them aside as best as you can, or at least try and not let those biases that you carry intervene with the way that you're interacting with your patient or your client. The reason why also I mention this is because when I talk to ethnically diverse communities and older adults, one of their main concerns as to why they don't approach formal agencies is their concern or their worry about the lack of cultural understanding and the lack of cultural compatibility of some of these resources, especially if they as a community believe these resources are biased towards diverse individuals, are not meeting their cultural needs, are not honoring and respectful of their cultural backgrounds. They are less likely to approach them. So really, sometimes the onus is on us to clarify what these resources and supports are and how we can adapt them to become respectful and honoring of the journeys of the patients or the clients that we're working with. And I can see some people sharing with me in the chat, so I'm just going to sneak a peek. So, sorry, I'm just going to scroll down here.
Yeah, we have from a Corfa.
Yes, it's an honor and a blessing.
Yeah.
Absolutely, Akop. I really believe that. I think it is because it's an honor and a blessing in itself to live to a longer life, right? When you're looking at average life expectancies in countries around the world, here in Canada, we have an average life expectancy that is considerably high. It hovers between 82 and 84. So that is in itself a blessing. And for an older person to live to that age and for us to be honored to look after them, I think that is a blessing. So coming back to me wanting you to think about these things, I just wanted to do a bit of a plug. And this plug is in line, and Sharon's probably laughing because Sharon is a huge advocate. Sharon Anderson is a huge advocate for the Way In Network, and she always talks about that. I'm so grateful for her in my life as well as the network's life. So I just wanted to do a plug-in. If you have clients or patients in Calgary, please let them know about this network called the Way In Network. The Way In Network is a free online, well, by online I mean a phone line, sorry, that is a older adult resource phone number for anyone who lives in Calgary 65 and plus. So what this number is, 403 Seniors, it's a network or a collaboration of organizations that serve older adults. The Calgary Senior Resource Society, the Distress Center, which takes our calls, the Calgary's Elderly Citizens Association that works with any clients within the city who are Mandarin or Cantonese speaking, the Jewish Family Services of Calgary, who work with individuals who live in the southwest of Calgary and onwards. And with the Resource Society, they work with clients who are in the northeast. And Carya, we work with individuals who are central, downtown, as well as northwest as well. So when a client or their advocate or family member or yourself call 403 Seniors for any need or support for the older adult. It could be they need help with interpretation, translation, access to mental health care services, connecting to housing or accommodation, applying for housing or benefits, or maybe even social engagement opportunities, for example. Any of these and more, of course, supports and resources that they would need to thrive or need to be supported, we can locate one of our organizations that we're collaborating with to refer them to that client, and they will connect these agencies will connect with the client through a social worker or a community link worker to call them or visit them at the home to discuss what their needs are to assist them. It's free of charge, and it's accessible to all people who live in the city. So that is the way in network. Another thing that I just wanted to mention as well, way back when AHS actually had this card called Jargon Alert. And it was a laminated card that a healthcare professional would give to their patients or their clients in the case that the healthcare professional or the person felt that they would need a pause when the healthcare professional was talking to them if the healthcare professional, doctor, social worker, nurse, was using jargon, was using big words that was overwhelming to the patient or the client. So we gave them this card, and that way they can flash that card in ways that are discreet, in ways that are dignifying, because sometimes a client or patient might feel embarrassed to say that they're not understanding what you're saying, or the words just don't make sense to them. And so we gave them this card to be able to flash it or share it with the person, the healthcare professional that they're talking with. And in the back of the card, it says, use me if you're not understanding, if you need the healthcare professional to pause, if you need further explanation. It was a really great tool. We don't have it anymore, but I'm an advocate for bringing it back, I think, especially as I work with linguistically diverse older adults who sometimes, even if they're bringing an interpreter who's a family member, might want that agency and control over decision making, but they really need to understand what you're sharing with them. And some of the people that I work with, they are low literacy, illiterate in their own language. So they cannot read and they cannot write their own language. So even if we give them brochures or handouts, interpreted in their own language or translated into their own language, they may be embarrassed to tell you they cannot read that. So why are cultural considerations essential in care? I don't need to tell you this because you're all experts in the area, but culture does shape the way that we experience growing older and aging. It also shapes the way that we manage and handle illnesses and end-of-life care. I worked with a Muslim family who actually didn't know, because it's not a norm in their culture or back home, of the existence of hospice and palliative care. And so their father, who had stage 4 lung cancer, who was at end of life, they were just stressed out about what was going to happen and the care that was needed for the dad. And it wasn't until one person from the community actually said, you know, here in Canada, they have this, they have a hospice and you can stay there and it will provide you with comfort care, that the family actually then approached a local hospice in the Northwest. The only challenge was this hospice, as beautiful as it was and as brilliant as the people who were working there were, they only usually catered for European, white, Christian, of Christian faith individuals. And so this family who was Muslim, who only spoke Arabic, also struggled with the system over there. And so there was this huge need for the family and its community to advocate perhaps for an imam, which is a religious Muslim person, to come in to recite verses of the Quran, which is their holy book, every time the family felt that there was a need for that. And also halal food that was needed as well for the family and for the visitors that were coming. But it was such a really great transition, because this hospice, who usually didn't do these things, was so open and welcoming to having conversations with the community and their family about end-of-life care for this individual that they really wanted to honor and respect. This is a really great example of how when we have conversations with community, we actually build capacity even better. So it's very important to understand, what does growing older, death and dying, aging, looking after older adults look like for our communities who are culturally and linguistically diverse? And how can we build this bridge of understanding, this bridge of trust with them, so they know we are able to honor and respect the journeys of their older adults? It's also important to respond to actually, first of all, I would say to acknowledge and identify and then respond to the barriers. Why are our culturally and linguistically diverse communities not approaching our services and resources? What is it that's preventing them from feeling that what we have is not adequate enough for them? It's also important from a cultural care perspective and a culturally compassionate perspective to really look at cultural diversity as a strength and an asset and not a weakness or a deficit. Just because my client doesn't speak my language doesn't mean that they do not come with strengths and capabilities and resources that I can actually benefit from and learn and then share with my team and staff member, or even at least acquire and strengthen my own cultural compassion capabilities myself. So I look at our older adult communities as sources of learning and knowledge and strength and resilience as well. And in fact, when you work with culturally and linguistically and spiritually diverse communities, it is so important to ask them, what are their needs that we can meet? And what is it they need from us in order for their journey with us to be as streamlined and smooth and honorable and respectful as possible? And even when we're working with our First Nations and Indigenous communities, for example, if you look at their holistic wellness wheel, it incorporates spirituality and spiritual wellness in that wheel. And I think that is very important for us to honor as well. What does that wellness or spiritual wellness look like to them? If you've heard me preach about words and the power of words, you would have seen this slide. So I do apologize if this is repetitive. But again, I'm a huge advocate for being mindful about the words that we're using because words have power. And by that, I mean, it is so important for us to ask our communities, especially if it's a community that we haven't worked with in the past, or we're unsure of what words are respectful and honoring and appropriate to use for them, is just to pause and say, can you please tell me what are the words that you would like me to use that are respectful for your community for me to use that address A, B, C of topics? And the reason why I say that is because the literature and the research actually emphasize the importance of coming across in respectful ways when using language, especially with communities that either have historically had a negative interaction and relationship with authority and formal agencies. And we think about our First Nations and Indigenous populations and our their experiences with residential schools, with spiritual entities and also healthcare. But I'm also talking about our refugees and newcomers who come from countries in which dictatorship, which lack of privacy, which lack of a trust with authority is also highlighted as well. And so it's so important to honor those experiences that we may not know of or stories that we may not know of by saying to them and asking, I don't know everything about your culture. I'm not going to be able to learn everything about your journeys and your experiences, but I would like for you to share with me. I would like for you to teach me. That approach is what we call in psychology cultural compassion and humility. Humility basically is admitting, I don't know everything. I would like you to teach me, and I would like to learn from you. So cultural compassion and humility is the approach that I would recommend we use. I would scrap cultural competence because cultural competence assumes that once you learn everything about a culture, you've learned everything that you would need. And I do not believe that we are able to do that. I don't know everything about my own culture and background, and I am of Muslim faith, and I am from Iraq, so I'm from the Middle East, and I'm still learning about my own culture and my own faith. So when we're approaching clients or communities and we're using words, it's so important to use the words that make sense to them. If the word elder makes sense to them, our First Nations and Indigenous communities actually prefer the term elder abuse or elder, because that is something that they're familiar with. But some other cultures, especially our linguistically diverse ones, when they interpret the word elder abuse into their language, it actually comes across as disrespectful and dishonoring. And so when I asked some community leaders and spiritual leaders, can I come and talk about elder abuse, awareness and education for the community, signs and symptoms, etc., they actually stopped me and said, we actually don't have elder abuse. We honor our older people. We respect and value them. So this elder abuse is a Western concept that you're throwing at us, and we don't have that. Now, I know from research that elder abuse, according to research, knows no race, no background, no ethnicity, no language, no socioeconomic, and no educational background. And so I realized that maybe then my approach to this topic is incorrect. So I went back to the community leaders and spiritual leaders, and I explained to them, I said, well, can I just explain to you what elder abuse is? Elder abuse is, and then I kind of gave them a little synopsis of it, is when you're mistreating an older person, whether it's physically, psychologically, emotionally, medicationally, or neglecting them, for example, or sexually, etc. And then they paused and they said, oh, so what you're talking about is you're talking about mistreatment of our older people. You're talking about the neglect or the cultural neglect of our older people. And they said, well, when you said elder abuse and we translated it into our language, elder abuse in our language comes across as physical violence or physical abuse towards older persons, but it's not necessarily what we're seeing in our community. We see other forms of abuse. So we thought you're talking about this particular form of abuse. So it's very important to use the words that are empowering, and be mindful of words that could be disempowering and strips away agency from our clients and people. So even when I talk to ethno community members now about mental illness, I am mindful of the fact that the word mental illness is a deficit-based word. And so when I talk to ethnocultural communities about mental illness, I approach it from, I'm coming to talk to you about mental health and well-being and how we can promote the mental health and well-being of our communities. And when I came back to talk about elder abuse, I said to the community, I'm here to talk to you about healthy relationships as we grow older and how we can promote and enhance healthy relationships for our older adult populations, and how to pay attention and signs to when these healthy relationships become unhealthy and how we can mitigate the factors that make the relationships unhealthy. And so those ways of revamping or changing or altering or adapting the words where they're more strength-based, they're more empowering, and more respectful and honoring and make sense to the clients was actually what allowed me to speak to 26 different communities from 26 different countries. And that's where when it is more person-centered and driven, which is that trauma-informed lens. So when you're working with older adults from ethnically diverse and culturally and linguistically diverse backgrounds, there are particular challenges that I would like you to be mindful of. Research has shown us that older adults, and by the way, when I talk about older adults, I actually mean people who are 50 plus or 55 plus, because even when I spoke to ethnically and culturally linguistically diverse communities and I asked them about this old idea about being a senior or an older person or an older adult, and I asked them, at what age in your culture, in your community, are you considered an older adult? Most of them actually said around 50, 55. And a lot of it is because there are cultural nuances that are at play. It's not a Western, and you probably know this, but the age 65 as that chronological age of a senior or an older person is actually a Western chronological label. It was created as a result of the interest of European countries to promote this idea of retirement. Retirement in itself is actually a 20th century Western concept. It's not something that people had or experienced prior to, and that's because life expectancy was quite low, and European countries wanted individuals to enjoy the rest of their lives that they didn't have much of left. So even the concept of older adult at 65 is actually what European and Western. And so when I talk to community members about the age of an older person, they tend to say about 50 or 55 because it's based on cultural nuances. And they would say things like, being an older person is almost like a cultural role that we have if we are revered, if we are the head of households or the head of our tribe or the head of our village, or if we become grandparents, for example. And so some of these individuals would experience some of these cultural roles and shift in roles as a result of those factors that are in play. So when I talk about older adults from culturally and linguistically diverse backgrounds, actually mean 50 or 55 plus. The challenges that they face when they move into Canada as newcomers or as immigrants, mainly actually the first and foremost one is the language barrier. Some of them, if they come in their 60s or 70s into Canada, they would almost always would tell me that they feel that they're too old to learn the language, and they would usually rely on their adult children or their grandchildren or people from the community to be interpreters or translators for them. So language is a barrier. Social isolation is also a barrier, because if your older person relies and is dependent on their family members for transportation, navigating systems, and sometimes these systems are unfamiliar to them, then they are more likely to be socially isolated because they rely on people to take them to their appointments, to their programs, to their religious or spiritual events. Settlement stress is also one of the challenging experiences that older adults usually from diverse backgrounds usually would discuss, and that's adjusting to a new country, adjusting to the climate, adjusting to values that are different, adjusting to food that is different, and that for them could cause them quite a bit of stress. Concern about discrimination, whether it's systemic or not, as well as racism as well, especially when we're working with clients who wear religious garbs, either a turban for Sikh or a headscarf, for example, or a hijab for our Muslim communities. They're concerned about their garments and their garbs that usually are at the forefront of what people in the society see that could result in them being discriminated against. Of course, a lot of the older adults also speak about the fact that they don't know what resources exist. And usually it's that cliche saying of, we don't know what we don't know, but also we don't know what we actually need. So we don't know what we want to ask about, or what we should be asking about from your agencies. And this lack of knowledge about what we have to offer, I think, again, the onus is on us, because there is an assumption in some of our organizations that we should expect people to come to us. When we're working with diverse individuals, and because of all these barriers that you see here in front of you, coming to us could be a bit problematic, especially if we haven't built that trust and rapport, and if historically they didn't have that trust and rapport with us as well. So again, I'm an advocate to pushing us as agencies to go into communities and introducing us to them and building rapport and connecting with them and introducing what we have in terms of resources to them and having conversations with them to find out whether or not we can adapt what we have in terms of resources and supports to meet their needs. The other barrier that older adults from diverse backgrounds could experience, which could be actually problematic, is dependence. The more your older adult client or patient is dependent on family members to navigate systems, for language, to for other needs, socially, etc., financial dependence. So the more they are dependent on individuals, the more likely they are actually at risk of experiencing exploitation and mistreatment. So in fact, high dependence on family is one of the main risk factors for older adult mistreatment and abuse. So what I do sometimes when I work with ethnically diverse clients, I try to find ways to promote their independence and their ability to be in control and have agency as best as possible. Because the more I make them independent, so for example, we hold programs about how to navigate transportation system in the city, or we have programs about how to use your phone to use Google Maps, or even to maybe order a taxi, for example, or to order food. So anything that I could do to promote the independence and agency of my client, I would do so, because I know the more they become dependent physically, cognitively, linguistically, financially, etc., the more likely my client is going to be at risk of being exploited and mistreated. So research has actually stated that ethnically diverse older adults are more likely to experience older adult mistreatment than white European older adults, and less likely to report it as well. The reason why, of course, are a variety: the language barriers, the stigma, the embarrassment and shame associated with it. Ethnically diverse older adults are also more likely to request that if you are going to intervene and assist, that you don't help them or just help them, that you help their adult child. And we find that request also from our First Nations and Indigenous communities as well, where family dynamic and family unity are so important that it is very important to honor and value how we can support the family and not just the person. Otherwise, they're going to be less likely to want to access our resources, less likely to trust that we have what they need from us. Ethnically diverse older adults, as I mentioned, are also less likely to report mistreatment, even when you're looking at the statistics, for example, in Canada, where it says 1 in every 5 people over the age of 65, and this is a 2020 stat, report experiencing elder abuse, it actually doesn't tell us what ethnic diverse backgrounds these individuals are from. There is an assumption that this is predominantly white, Western, older adults who are reporting elder abuse. Ethnically diverse older adults are also more likely to depend on an adult child, especially if you have your older adult client who is in Canada as a result of the family sponsorship visa, where the adult child, who's usually the person who sponsored them, is financially obligated to meet their needs for 20 years, putting our older person at risk. At some point, that adult child might feel not obligated anymore to meet the financial needs, which means that our older adult is not able to purchase medication, is able to pay for transportation, to buy food, or even to buy clothing for themselves. We, unfortunately, cannot assist as organizations some of these older adults because we are limited due to the immigration status that they have, which puts that person at risk, which means that if a person who comes as a guest or on a visa to Canada and is exploited or mistreated or abused, they are less likely to talk about it because they know that there's not going to be much that we can assist them with. They're less likely also to identify forms of mistreatment. Even when we look at elder abuse, it is actually from a Western lens. Some of our older adults who are linguistically and culturally diverse actually talk about other kinds of abuse, like spiritual, cultural abuse. They don't necessarily identify sexual abuse. And I've had conversations with communities who say, we don't sexually abuse our older people. And in fact, one of the community leaders came up to me and said to me, we didn't appreciate the fact that you talked about sexual abuse. Our community felt uncomfortable when you talked about that. So it's also important to be mindful of, okay, I know now that this is probably not something that they would like to discuss, but I have a moral obligation to mention it. So I wouldn't have it on the slides. I wouldn't have sexual abuse on the slides. I would mention it verbally and say, and there are other forms of abuse like sexual abuse. If you would like to address this further, I'd be more than happy to have a one-on-one conversation with you, and that's to make it less uncomfortable for the community. Ethnically diverse older adults are less likely to access resources and supports due to their belief of the lack of cultural compatibility or historic negative experiences. They're also less likely to know of the resources that exist, and they're less likely to have or know about their own legal and health rights. So again, as I've embarked on this whole ethnocultural elder abuse project last year, I realized that the majority of our ethnically diverse older adults do not know what a personal or an advanced directive is because it's not a norm back home. They don't have it. They don't know what power of attorney or enduring power of attorney are as documents. They may have heard of them, but they don't know how to acquire one. And almost all of them did not have a will, because most of them relied on their cultural understandings of wills. And usually they would say, we back home have verbal wills where we share our wishes on our deathbed or close to our deathbed verbally. And those are culturally and religiously respected in that culture and community. So I had to explain to them, verbal wills don't hold ground in Canada. So it's really important to also understand this whole concept of personal directive, especially from a healthcare professional perspective, I think is very interesting and important to address with your clients who are linguistically and culturally diverse. So when it comes to understanding the definitions or older adult mistreatment, so OAM is older adult mistreatment. The federal government of Canada and the World Health Organization now calls it OAM or MMOA, which is the mistreatment of older adults. So it's either older adult mistreatment or the mistreatment of older adults, whatever you want to use, you can use, but we're moving away from using the term elder abuse. So it's really important to understand how diverse backgrounds actually define older adult mistreatment. We had a community, for example, who said, even though I'm not working, and even though I live with my adult child, in my culture, I'm still obligated to provide financially. So when I get my old age pension, I hand my card to my adult child or my grandchild so they can use this money as they wish, because it's my role as I still have in the hierarchy of the family roles and hierarchy, the grandparent is still at the head of the household. And so even if they aren't even if they're dependent on various aspects on their adult children and grandchildren, they still feel obligated to meet their financial needs. I am the parent, I still have to provide. And so in our Western lens, this could be a red flag for financial elder abuse if the grandparent has given the card to the grandchild and the grandchild always pulls out their old age pension. But in the eyes and the lens of the grandparent, this is not considered elder abuse. This is considered their responsibility. So it's really important to have discussions with your client. Do they know, you know, in the Western legal system, this may be a red flag. And to understand whether or not their basic needs are met. Are they being fed? Did they have financial capabilities and capacities as well? Because if they do, then it is not considered elder abuse. So if your client or patient is willingly, as long as they have cognitive capacity, is willingly given their bank card to a family member, and as long as that older adult client of yours has their basic needs met and has the capability of taking that card away, it may not necessarily be considered elder abuse, but it would be considered something that I would consider a red flag in case the person will be taken advantage of or if they lose cognitive capabilities. In some families that I talked with, they actually got offended when I used the word caregiving. So caregiving, when translated into other languages, and that's why I say the power of words and being mindful of not verbatim translation. We work here with agencies that do verbatim translation from English to other languages. And when we shared it with communities, some of them got offended because verbatim words from English to their language actually comes across as disrespectful. So rather than using verbatim translation from English to other languages, I would then, before distributing and disseminating it to the mass populations, I would take that document and share it with community leaders or religious leaders and ask them, does this document come across in your language as respectful and honoring? And if it doesn't, then please can you give us some suggestions and feedback? Because, for example, the word elder abuse, when translated into other languages, as I said, that actually came across as disrespectful. So what they said to me is, we don't call in our community older adults this word of yours, which is senior or elder. We call them, and then they gave me, and so one word in English ended up being about 2 or 3 words in Arabic, for example. When I talked to them about dementia, the literal translation that the interpreter did from English to the language, dementia came across as someone who has lost cognitive capacity. But the word that they used was actually also very disrespectful. And so again, I got feedback that we actually don't call it this, we call it something else. And so again, it's just this conversation that you'll have with community members is so important. Caregiving, in fact, came across, translated as a person who is not a family member, but is paid to look after your older person. So it comes across as a person who's a stranger to the family and is getting paid to do this job. So some of the family members actually were offended by this because they said to me, but we're not strangers and we don't get paid to do this. So I asked them, what is it that you call yourself in your community? And they actually said, we call ourselves family members. We don't call ourselves caregivers or carers. This term is a Western term. It's a Western concept. We are family. If we did hire somebody to look after, and most of them don't, by the way, because they find that taking care of their older person is a family responsibility. It's a family duty because of their cultural upbringing. But if they did pay for a caregiver, that's the only time that they would use the term caregiver. It's also important to understand from an ethnocultural perspective what the influencing factors are that could lead to this misunderstanding of elder abuse. So I'll show you this, and you'll have it in the PowerPoint. So, all right, whoop, my mouse is not working the way it needs to. Sorry. There you go. So these are actually the risk factors for elder abuse in ethnocultural communities, and some of these I've already talked about. So this is so research has suggested that ethnically diverse communities could experience, their older adults could experience a higher rate of potentially being at risk of or vulnerable to mistreatment and exploitation and abuse if they are linguistically diverse, if their level of education and literacy is low, so low literacy, low levels of education, if they arrived through visas or sponsorship because they become more dependent financially, etc., on family members, it puts them at risk. If their family and children are already experiencing also integration and settlement stress. So, for example, we had clients who say, I don't want you to look after me. I have a good child. This is a good child of mine. However, they're unemployed. However, they're also experiencing settlement stress. However, they might be going through mental illnesses that has been undiagnosed. They might be going through alcohol or drug use, for example. Help them and they'll stop abusing me. So if you are a parent, you know, some of us tend to find excuses for why our kids aren't behaving nicely or the way that we think is honoring and respectful. We'll find excuses. So these older adult family members or parents usually do state that this is a good kid. However, they've got challenges, help them. And some of our older adult parents who are relying on the adult children to be carers for them or to look after them, if the adult child themselves don't have understanding of the resources available to become carers and the supports available in the province, then we know about caregiver stress and burnout. Not that there's any excuse for it, but if you are an immigrant or a newcomer, the lack of knowing what resources are available is problematic. And by the way, again, another plug for Caregivers Alberta. Wherever I go, every ethnocultural community that I enter, I always talk about the great resources for Caregivers Alberta, because most of these communities don't even know of the existence of those agencies. And as I mentioned, the more they're dependent on family members, and the older they are when they arrive, the more problematic these challenges become. I'm going to whiz through this because of time, but this is the definition of elder abuse. So the reason why I said it's very mindful to not use our definitions that are usually Western in their lens on all people, because it could come across as disrespectful, but also it comes across as culturally, incompatible, I guess. So it's very important to understand, yes, we can share the definition to clarify what elder abuse is from a Western lens, but it's also so valuable and important to say, but that's the Western definition. I want you as a community to talk to me about how would you identify your friend, your neighbor, your family member who may be experiencing these forms of mistreatment. How would you identify that? And what are the symptoms that you would look for or the signs that you would look for? The Western forms of elder abuse that have been identified through definitions are the ones that are the common types. The diverse ones, when I talk to ethnocultural communities, are the ones that you have on the other side. So a lot of the ethnically diverse communities don't necessarily identify with sexual abuse or physical abuse as such, but they would talk to me about financial abuse. They talk to me about emotional and psychological abuse, but they lean heavily on my children don't visit me every day, or my adult child yells at me, or they don't take me to my spiritual or cultural gatherings and events, etc., or that they don't check in on me as such. And some of the adult children would come up to me and say, when I talked about neglect, for example, they talked to me about how they're now concerned because at times they now are seeing that they are doing, their behaviors is unintentional neglect. And so they'll say things like, you mentioned if I don't meet the basic needs, or if we forget to renew the medication, we don't take them to appointments, we don't know how to change, for example, wounds or whatever it is, could that be neglect? And so I'm always erring on the side of caution of pointing the finger when I talk to ethnocultural communities, because I really do believe that a lot of these behaviors could be a result of their lack of education and awareness and knowledge, and also because of some of the challenges that they're experiencing themselves, that if supported, perhaps we would see less of that elder abuse that is occurring in those communities. So when it comes to understanding the barriers, so why would older adults or their family members not feel comfortable? I mean, I don't want to say this is just rural context, but I would just also highlight, of course, if you are from rural parts of the province, how limiting it is anyway to access any resources. Even I was talking to Helen and Kate about this. As a city, as a big city in Calgary, and Edmonton is a big city too, we do have resources. However, it could be really overwhelming for some of our communities. And sometimes I find that the rural communities are so efficient and so strong in terms of being able to rally around some of their community members far more better, I believe, than the bigger urban cities themselves. With that being said, I do appreciate the fact that there are limitations, either to access culturally appropriate resources, and the more tied to the community dynamics, by the way, the less likely it's going to be that they're going to talk about elder abuse. So we know from research, but also connecting with community members, that the more the community identifies with their ethnic identity or their religious or spiritual identity, the more they're going to hold on to some of those values. Some of those values is that we honor our older people, that we respect them, that we take care of them, that what happens in the family and community stays in the family and community. They're less likely to actually talk to you about the stigmas and about the problems and challenges, because they might find it stigmatizing or embarrassing, or they don't want the spotlight in that negative way to be highlighted on them. They're also going to be these fears, as I mentioned, of bringing shame to the family. So I had older adults who'd say, it's very hard for us to talk about, this is our child. This is the product of our upbringing. How embarrassing is it and shameful is it for me to talk to my community or formal agencies about the product of my upbringing, about my child? So some of them believe that it brings shame to them. Some of them actually believe that it is the abuse they're experiencing is a test from God, from a higher being. And these religious or spiritual groups would say things like, this is something that God has given me, and it's a test of my patience and my belief and faith. And the more I endure it and tolerate it and not complain about it, the afterlife is going to be a better place for me, or I will be rewarded in the afterlife. And so sometimes, again, it's very important to respect where the client is coming from when they're not wanting to report to elder abuse, and not be dismissive, but also to highlight, I respect that. I understand this is very important. However, I still want to make sure that you are safe. How can we still maintain your safety? And the reason why I say that is because the majority of ethnically diverse older adults that I talked to actually said, we don't want to leave the house where we're being abused because it is the only home that we know. We would rather stay here and tolerate it, because what is the alternative? We're going to be isolated from our family. We're going to be isolated from community. You're going to take us to a place where people don't know us and we don't know anybody. So they would actually rather tolerate the abuse. One client actually said, I would only speak about the abuse if my child broke my bones and I ended up in hospital. He said, anything other than that, I would tolerate. So it's important to also understand that some of these older adults, I would find, are absolutely resilient. They are strong. They are capable. They have capacity. Some of them are stubborn, by the way. Like, even when I'm talking to them about, yes, but, here we are with great intention, wanting to protect them and keep them safe. But here they are standing their grounds and saying, there is nothing you can say to us that would make us report our child, because we don't know what's going to happen to them, especially if they don't understand the legal system. So I urge us to look at the strengths of our client. Some of them, especially if they're religious or spiritual or cultural in their identities, some of them might want that. They might want that holistic approach to their supports and resources. And culture could be a strength, and it could be a source of a risk factor, really. Because like I said, if they hold their identity very strong to them, they're more likely to honor the values of their culture, which means speak no bad and speak no evil about what's happening. But at the same time, if it is a culture that honors and reveres and respects older adults, it could be one that you can promote and highlight. So rather than us coming in and looking at them as people who are doing wrong or by their older people, we can say things like, let's have conversations in the community about how we can enhance relationships, how we can promote resilience and strengths within our intergenerational households, because a lot of these ethnocultural older adults live in multi-generational households. So these are the strengths that your clients might have. The strengths here are, you know, they're resourceful, they're resilient, they're adaptable, and I would always promote and highlight that. So this is where I'm going fast because of realization of time as well. But you have all of this, these notes, and I do apologize. So how do we respond to it? I think it's so important to be mindful and respectful of the cultural norms and not be dismissive of them. I would always state that I would ask my client, what is it that I can help you with? How is it that I can support you? What is it that you need from me in order for me to ensure that you still remain safe and your dignity and agency is intact, and have conversations with community members and community leaders about how these resources look like. Most of the time, you really don't need to reinvent the wheel. So how do you keep them safe? Well, like I said, build trust with them. And most of these old adults will say, I'm not going to leave. So build trust with them, assess what safety looks like to them, create a plan that is respectful, but also makes sense to them. Ask them if they have someone that they can walk to, because some of these individuals, if they can't use public transportation, you want to ensure that they are a walking distance. Is there someone a walking distance that you can trust, that you feel safe staying with until we figure out an alternative for you? And then engage with community to see what is best for them. And assess those plans regularly. That's really what I want to say. But always advocate for their agency and advocate for their independence as best as possible. This is the part that I won't be able to go through, but I just wanted to highlight, I don't prefer using competence, compassion, and humility, as I mentioned, are my go-to. And what compassion is, it's really the practice of kindness. It goes without saying that you are all practicing kindness yourselves. So I'm wrapping this up, but I just wanted to enhance this whole idea of why it's important for us to be very mindful of the needs of our individuals and building trust with them, and honoring that decision making. So I don't want to mess all of this up for you, but I just wanted to kind of highlight this spirit of inquiry. Asking questions that are honoring is so important. Asking them, what is it about your culture and language that you'd like me to know of that will help me support you is very important as well. And I'm going to stop here. Thank you so much.
Thank you, Rose. What a packed hour for all of us for all the information. And I know everybody will be looking forward to receiving the recording and the slides in there. So really appreciate your time today. Yeah, we just have the 5 minutes left there. Just some really good information for all of us to take forward.
Absolutely. And I'm just going to leave you with my email if you want to contact me or connect with me, but everything that I said in the slides. And there's also a case study with discussion questions that I've just put in as a bonus for you to also work on as well. Thank you so much. I appreciate it. I have to
bet. You bet.
if you have any questions, please feel free to ask. And I would love to see your faces at some point. So if you're here in Calgary, if I'm going up north, I'd love to connect with you. Thank you so much, everyone, for
You
everything that
bet.
you're doing. Thank you. Take care.
Thanks. Hey, bye-bye, Rose. Well, I'll just bring up our last slide here for just some resources and that to share with the group. Here we are. Maybe we'll have to make sure we have her back again for another session to keep digging into all of this. So just wanted to share a training opportunity that I found out through, I think, our Banff Canmore team, that the Opening Minds Through Art program, there is an online training for that. And the website is there, the Scripps OMA. The link will be in the email that Kate sends out after that. And there is a cost to it, but just wanting to let people know that it is an online opportunity there for that training. And then just wanting to share with the group that we've had some really good news this week, that our request for an extension for an extra 3 years for initiative has been approved by Health Canada and Alberta Health. And so we will be around till 2029. So we're really happy to share that with the group there. So any kind of general questions that people wanted to ask? We just have 3 minutes here. Otherwise, we'll give you back 3 minutes in your day there with it. So thanks everyone for joining in.